Lots of room in front. Good afternoon. How are you guys today? You having a good idea share so far? Before I get started, how many of you listened to my presentation last year at ideaShare on DSCSA? Great. I didn't do a good job explaining it. You had to come back for more. Okay. I want to walk through talking to you about the Drug Supply Chain Security Act, what's going on in the industry at the moment a little bit, and what McKesson can do for you. But this has been a 10-year journey that we began a while ago. And by the way, my name is Scott Mooney. I work at McKesson on DSCSA, and I also work out in the industry with GS1 Global Healthcare and some other groups working on the requirements for DSCSA. So the Drug Supply Chain Security Act began in 2013, and it's been a 10-year evolution. We were supposed to last year be done with this in November 27th, and shortly after we had ideaShare, we received from the federal government, all of us in industry, a one-year stabilization period that allowed them to move out the enforcement date for 12 months. They deferred it out to November 27th of 2024. But during this process, they want us to mature the systems that we have, perfect the systems that we have, so that when we go live on November 27th of this year, everything works as it's supposed to do. The goal of this is to be able to trace an individual serial number at the serial number level of a product all the way through the supply chain. So they want to trace an individual bottle from the manufacturer to the distributor to the dispenser. There's nothing in the DSCSA about what you have to do with the data once you receive it, other than you have to store it for 6 years and use it in your investigations. You don't have to put it into your prescription records and track it to the patient, but you do have to keep track of it from a purchasing perspective. Along the way, as we went through this journey, you may have noticed that the bottles that you're receiving in your pharmacy have had to be changed. The information that's encoded before was just the NDC number, and it was encoded in a linear barcode. But since 2018, every bottle has now had a 2D data matrix barcode on it that not only encodes the NDC number of the drug in that barcode, but it also encodes the serial number of that individual bottle, the batch that it came from, and when it expires. And this is critical information for us to use in the supply chain to be able to track that bottle through to your store. We also keep track of it at the case level with a new marking system on cases, so we can track what's inside the case. If this particular unit has 32 inner packs in it, we're keeping track of what serial numbers are inside the case, and the case itself is serialized, and we can even carry that all the way through to the pallet if you happen to buy in pallets. So the changes that are coming up this year that were deferred from last year, for those of you who came to last year's presentation, will look very familiar. By November 27th of this year, manufacturers and wholesalers are expected to keep track of what serialized information they sell to each individual customer. We need to make that available to you in an electronic, interoperable manner. So at McKesson, that means by default, all of your data is going to be added to McKesson Connect. We're going to put it in there for everybody. There's no enrollment that you have to do to have your data available to you in Connect. If you wish to have a third-party solution provider, we'll also put your data into that third-party solution provider system. But we need your participation to identify who's your solution provider and where you want the data to go. We have to make a connection to them. So there is an enrollment. We ask that you step forward through your sales rep, raise your hand and say, I'm going to be using this solution provider. Please send my data there. And we'll be happy to do that. Also for this November, our requirements for recognized standards. This is how the data is exchanged. In the United States, that's a standard EPCIS file, or Electronic Product Code Information Services. It's the manner that we're going to pass the data to your solution provider if you're using one. There will be changes coming this November for saleable returns, and we'll talk about that a little bit more. And we have to make meaningful use of the product identifiers that are attached to the product. So let's start with what you have to do in the pharmacy on your own that McKesson cannot assist you with, because this is very important for you to understand. Oftentimes what we hear when the regulators talk to the pharmacies is, pharmacies may tell the regulator, I don't have to do anything for DSCSA because my wholesaler is going to do it all for me. And I'll walk through what we can do for you, but it's very important you understand what we cannot do for you, because there are some lines that we cannot cross as a distributor that you have to do that are part of your legal obligation. And we're going to start up in that 11 o'clock position. You've been required since 2014 to only buy products from authorized trading partners. If you're buying from a manufacturer direct, that means that they have to be registered with the Food and Drug Administration. If you're buying from a wholesaler like McKesson, it means that we have to have a license from the state that we're shipping from and a license for the state we're shipping into. And you can find those licenses online to validate that. Now, rest assured, McKesson is licensed for all of you and all the places you service, but you do have that obligation to make sure that you know that we're licensed. So don't just take my word for it. You can go onto the FDA website and confirm that. The second one that's in the 1 o'clock position is probably the most misunderstood thing going on in the independent pharmacy space at the moment, and that is that you as a pharmacy have to have a suspect and illegitimate drug policy in your pharmacy, and you have to conduct investigations when you see a product that doesn't look right. If you're accustomed to a product coming in and it normally has a green cap on it, and all of a sudden you get a light blue cap on it, that might be an indication that there's something wrong with that product. And before you use that for a patient, you're obligated to make sure that's a legitimate drug. You've been required to do this for the last 8 years already, so it's continuing to go forward. But please be sure that you have in your pharmacy somewhere an SOP. You can find mock SOPs or sample SOPs on the Health Mart website. You can find them on the NCPA website as to what a suspect product investigation may look like. And once you write that for your pharmacy, you put in your name and substitute out all the different things in there, like where it says your store, you put in Jim's Pharmacy or Janice's Health Mart. Once you have that, be sure to train your staff on what it says. If it says every time you have a suspect product, you place it on the white shelf, make sure that they're doing that every time they have something that looks suspicious, because the regulators will ask you about that. They will come in to say, I want to look at the last 3 times that you had a suspect product, and did you follow the SOP that you wrote? They'll be more concerned with whether you followed what you wrote than they will be with whether what you wrote was the right thing to do or not. Because if that's your process, and you want to make sure you're following it. The next one coming around the corner here is to ensure you have a global location number. And McKesson assisted most of you in this room with getting a global location number for your pharmacy. We print these on the invoices. They've been printed there probably for about the last 5 or 6 months so that you can see them. You likely will have 2 for every pharmacy. You might have a ship to, which recognizes the store number. You might have a sold to if you have multiple stores that recognizes your corporate entity. It's possible for them to be different from each other. If you only have one pharmacy, they're probably the same. But if you've got multiple pharmacies, the sold to might be the corporate office. The ship to would be each individual store. We were able to work through GS1 and secure a global location number for all the pharmacies that we deal with that have less than 9 locations. GS1 would not allow us to enumerate pharmacies that had more than 9 locations. You have to secure those GLNs on your own, but we were able to help assist with the ones that had less than 9. We will begin using global location numbers in our processes to capture data for your store. That's how we're going to associate serial numbers with which stores they were purchased by. So our cutoff date for customers to have a global location number is August 6th. I don't anticipate any of the people in this room should have a problem with that because we've been very monitoring, watching where you're at in the moment, which stores have location numbers, which stores don't have global location numbers, and we're pretty confident in the independent space this is not an issue. But that's our date to make meaningful use of the global location number at McKesson. The next 2, I'm going to qualify because this is kind of some breaking news. When I talked to you last year, we talked about you need to know where your DSCSA data is going, whether you're using our portal for it or whether you're using a third-party solution provider. And I strongly encouraged you last year to, before the inspector shows up, know how to get into those systems, know how to log in, bring the data up to the screen so when they're standing there drumming their fingers, impatiently waiting for you to give them the answer, you already have figured out how to get into the system, and that's not the first time you're trying to log in to retrieve your data. The breaking news that I want to share with you is that a week ago Thursday, the FDA has decided to grant small dispensers additional time on some of their DSCSA requirements. Only buying from an authorized distributor, still in place. Being alert for suspect products, still in place. I mentioned that McKesson's going to need the GLN on August 6th, still in place. But the FDA is going to give small dispensers, and they define that as corporations that have less than 25 pharmacists and techs. If you fit that category, you're going to get 2 years from November before you have to be able to know how to retrieve your data. Now, we as a distributor still have to capture your data, we still have to keep track of it, and we have to use it for saleable returns. But you won't have to make meaningful use of the data for 24 months. You won't have to use it in your suspect product investigations. You won't have to verify inventory until November of 2026. But your data will still be there because everybody that sells to you is still obligated to provide you with the data. We talked a little bit about data. Finally, the last obligation that we cannot do for you is we cannot take and talk to the regulators on your behalf. If a state board of pharmacy comes in and says, I need you to demonstrate to me the DSCSA data for a particular product, whether it's lot level, which we've been doing since 2015, or whether it's serialization, which is coming in the future. We as McKesson can't answer your question from the regulator for that. We can help you find where it's at. We can point you to the tool. We can help you get in to figure out how to get the data, but it's your obligation to respond to the regulator yourself because they need that to come from you, the license holder, not somebody who's selling you products. So that's one of the things that we also cannot do for you. But let's talk about what we can do for you, and we've been working on this for a while. We've assisted with getting global location numbers for most of the independents. We have partnered up with GS1 Standards, the people who issue global location numbers, and we've been able to submit to them lists of our customers who are independent accounts who don't have a present GLN because we were able to look in the system and see that. We submitted them to GS1 and they've assigned a GLN to all of our small business customers, all of our small facilities. Some of you may have also done that on your own. So it's possible that we might have helped get you a GLN and you might have gone out and gotten your own, or perhaps one of the other wholesalers, Cardinal or Syncora, may have done that for you too. So presently we're doing a cleanup effort across the industry to look for duplicates and reduce the duplicates out of the system. We will be doing the capturing of the serialized product identifiers and all the data activity that goes with determining what serial numbers went in your totes today, what serial numbers went in your totes tomorrow, and we'll associate that with the labels. So conceptually, every label's got a serial number on the tote label. We'll know exactly inside this tote there were 27 products, and it was serial number 1 of this NDC, serial number 25 of the next NDC. And that's the level of information we're going to share with you with your DSCSA data. We will also provide for you access through the portals on demand to be able to go into McKesson Connect and view that data anytime you want to view it, search it for a particular NDC number for a range of dates or a particular serial number, maybe use it to look for a lot number that you're wondering if it's on recall, if you ever bought it. All of those things can be facilitated through the portal, and you can do that on demand, and we will provide that to you at no charge as part of the basic package at Connect. But in addition to that, as I mentioned, if you have a solution provider, we will push that data to your solution provider, which often brings up the question, do I need a solution provider? And there's a couple of them here demonstrating their wares. Our perspective is we don't care whether you have one or don't have one. We will follow whichever model is appropriate for your business. Your decision, though, likely should be based on how often are you going to be accessing the data, how many stores you may have, and also how complex is your supply chain. If you're buying primary with McKesson, for example, let's say you're buying 90% of your stuff from us and you have 2 secondaries that make up 10%. Portal for you might be a great opportunity because as long as you ask your question when you have one of the portal with the 90% in it first, almost all the time you're going to get your answer right away and that's the end of your inquiry. It's only for those 10% that you bought from somewhere else that you might have to go to a second portal or a third portal. That's the downside, is you might have to look in multiple places if you're using a portal system. If you're using a solution provider, the upside is they can aggregate all that activity into one spot. They can reach out to McKesson and say, I need the data for Jim's Health Mart sent here. They can reach out to the secondaries and say, I need the data for Jim's Health Mart sent here. They can all be put into one system in one place. That's the upside. They can aggregate that data, which we can't do on our portal. The downside is this is a fee-for-service system that you have to fund yourself. So you'll be paying some kind of a fee for it. And for your business, it's really a decision of what is the fee I can get versus how often do I have to do it? How much of my time and how much of my effort am I going to be doing it? So it's kind of a decision you have to make for your business. We will support either model you want, but you do need to make a decision along which way you want to go. I mentioned that they gave a 2-year extension for small businesses on that data requirement for serialization. We will be publishing your serialized data to McKesson Connect, so it will be there. We will also continue to publish your lot level data to McKesson Connect for the next 24 months as you go through that conversion period. So at a minimum, you have the same data you've been getting since 2015, continuing for 2 more years, but you will also have access to the serialized data during this next period for the small businesses. And then behind the scenes, we remain very committed to the industry to try to keep engaged and helped steer this whole DSCSA conversation to a point where it's manageable for us as distributors and it's manageable for you as dispensers. So to do that, we not only work internally on our own processes, but we work through a group called the Partnership for DSCSA Governance, which is designed to set the same standard for every transaction in the United States so that a manufacturer uses the same file structure McKesson uses, Cencora uses the same file structure McKesson uses, to make sure that that data exchange is very common and very standardized. So those are the things that we're prepared to do for you. Which brings me to the questions, and I'm going to first start out with, we have a booth over here. Matter of fact, you can see it on the first one on the end there. I will be there the rest of the day today and all day tomorrow if you have any questions. I'm assisted over there by Heather Cooley, who's also working on the DSCSA project with us for our pharma businesses, and several other people. So we can answer your questions about GLNs if you have them. We can answer your questions about DSCSA in general. But before I leave you with that, I do want to walk through and give you one other highlight, because I did a podcast this morning, and some of you I saw standing in the hallway out here listening, and that has to do with saleable returns, and it's really important you understand this. This November 27th, the saleable returns requirements for wholesale distributors becomes part of the law. Up until this point in time, from the DSCSA started in 2013 to now, we've only had to ask, did you buy the drug from McKesson? And did you store it correctly while you had it? And you've been signing the back of your return authorizations attesting to that consistently for the last 10 years. Beginning this November, distributors like McKesson are going to be required to validate the return that you make and prove that the bottle you're returning is the bottle we sold you. This has some really ugly nuances to it. There will be 1,000 bottles in this lot, all have the same lot number, but every bottle has a different serial number. And we're going to be required, when that return comes back, to go look at our DSCSA data and say, Jim's Pharmacy just sent back bottle number 1. Can we prove Jim's Pharmacy bought bottle number 1 from McKesson? And if the answer is yes, then and only then we can take that as a saleable return. This is not something we want to do as our operational process. This is a minimum requirement of the law. It's called associating the return with its previous transaction information. The rub for you is that this might have been a 340B bottle. Yeah, that got you excited. Technically, under 340B rules, that bottle was not sold to Jim's Pharmacy. It was delivered to Jim's Pharmacy, but it was sold to St. Janice's Hospital. And unfortunately, the law is going to require, when we test that only St. Janice's Hospital can get the credit for that particular return. It cannot be credited to Jim's Pharmacy because they were not the legal purchaser of the product in the first place. And that's going to be a challenge for us for a while, because your models for 340B were all predicated on the way the replenishment model worked before. That's the way your structure with your covered entities was laid out through your third-party administrator. This is going to throw a bit of a kink in there, because you will not be able to return 340B product from your pharmacy on your pharmacy's account. You can ask it to be returned on the covered entity's account, and the covered entity can get credit, but the covered entity will get the 340B price credited to them, not your price that you paid for the original bottle. Unfortunately, there's not much we can do with that in the law. The law is very specific. There were concerns about this topic raised by NCPA, NACDS, APHA, and a couple of other groups back about 4 or 5 years ago. And after long consideration, the FDA has published a letter that said, yes, we understand the concerns. We understand about overstock in retail pharmacies, but the law is fairly clear what Congress wrote. Only the party that purchased the product can make a return, and they did not budge at all on this particular topic. So that does go into effect this November. Even though you're exempt for 2 more years from the data use, the distributors will have to use that data this year. So with that, I'll pause. I think we've got a few minutes left here. About 10 of them, we'll open it up for your questions. So this is your opportunity. And Karen, you got the mic. And please speak loud, because I do have just a little bit of a hearing issue with these speakers.
What about if the drug, like you mentioned about 340B, is purchased by the wholly owned pharmacy, which means that pharmacy is a department of the hospital or the entity? Can that pharmacy return that bottle at that point?
Yeah, so let's kind of get into your global location numbers and how the global location numbers are used. If somebody has multiple businesses, whether it be a hospital setting with a retail pharmacy as well, doing 340B across them, if they've got the same global location numbers in both settings for the sold to party, because the same corporation owns them, there's no issue, because what we're matching to is the global location number. The same thing applies if you have multiple pharmacies yourself. If you buy something in store number 1 and you transfer it to store number 5, that's an intercompany transfer and you're allowed to do that. And the way we've set this up from DSCSA perspective, if both those stores are Jim's Pharmacy 1 and Jim's Pharmacy 5, they both have the same sold to GLN, global location number loaded, either of those is able to send back that return and clear the DSCSA hurdle because we're matching those global location numbers to serial numbers. So we can make it work, whether it's a health system in a 340B pharmacy, whether it's 2 retail pharmacies, we can make returns work across them as long as the global location numbers are the same.
So is the bill to ship to, you said there are 2 GLN numbers that are given. One is bill to, another one is ship to, correct?
We actually tell you sold to and shipped to.
Sold to
And
shipped
the
to.
nuance is subtle. Bill to tends to be where your invoices go.
Yeah.
Bill to sometimes is a payment clearinghouse, so we've stayed away from using the bill to, but we've used the sold to. What was the legal owner entity that you identified for us?
Okay, so if I have a Cardinal account, the sold to a GLN number will be the same for them as well as you, or would that be
It would be, you'd use the same GLN with everybody because those identities are your identities, whether you're dealing with us, you're dealing with Cardinal, you're dealing with Syncora. You should be using the same GLNs. What won't work in the saleable return context is when that product comes in, we'll look at that GLN and say, yes, I understand that to be Jim's Pharmacy, but we don't have a sale of that particular bottle if you bought it from Cardinal. We don't have that in our record, so we will reject that return because you didn't buy it from us.
Ship to is different.
Yeah.
Okay.
Other questions?
We're also a 340B pharmacy, and I was wondering if there's a model that shows that instead of the product, because usually what happens, there's a delay from the time we have the prescription, we have to get the product, to the time that it actually clears that billing. And so I was wondering if there's a way that instead of that product sort of like being held for us until the billing went through, and then we can draw the product. That way there's a seamless return.
Yeah, I think that comes more into how your TPA, your third-party administrator, is kind of engaging with you. One of the issues we do find with 340B, and I'm knowledgeable enough on 340B, I can get myself in trouble explaining it at times because it's very complex. But one of the issues we find is oftentimes if your TPA is a little slower or is batching your replenishment, you get overstocked at the end of the month because they saved up 4 weeks worth of replenishment and you might have used 1 bottle a week all the way through, and all of a sudden here come 4 bottles at one time. I think there's an opportunity to work with the TPAs to see if we can get that replenishment done more frequently, and that should reduce your return risk because if it's 1 bottle in the first week and you're using that for the second week and you're using the next replenishment for the third week, you're a little bit ahead of it and it's a little easier approach. It's these large surges where somebody gets a month's worth or a quarter's worth. I even saw that recently. They got a whole quarter replenished at once, and then they were grossly overstocked, and that's where the return problem comes from. Yes, ma'am.
Scott, what would you say the impact would be to alternate distribution models?
You're going to have to be louder than that.
Sorry, what would you hypothesize the impact would be to alternate distribution models?
You're talking about where the hospital is buying product into the hospital and then they're shipping it themselves? Is that your alternate distribution definition? I think the same problem would still exist if the hospital, it depends on how often are they replenishing that forward pharmacy in this model. If they're sending them the replenishment relatively regularly, they have a reasonable shot of using that product as it comes in without becoming overstocked. But if the hospital's batching it up and says every month I'll send you all your 340B replenishment, that we're back to the same problem. It's just coming from a different source. Like I said, I know just enough about 340B to be dangerous in answering the questions. Okay. Yes, sir.
Hi. So I read the article last week about the extension given to small distributors,
Yes. Small dispensers.
dispensers. What if, because sometimes we help out doctors' offices in our area with products, what if they have a bigger operation where they have more than 25 employees? Are they going to require the data that we don't yet have to send them?
So if you're talking about selling from your pharmacy to the practitioner, there's already a couple of different things going on there. There's the ability for you without a DSCSA complication to sell to an individual practitioner for use in their own practice. There's not a lot of explanation out there at the moment as to how big that individual practice could be. It tends to almost presume you're talking about an individual doctor's office as opposed to a clinic. So there's not a lot I can really refer to for background to answer that particular question.
What if it
You
was
as
a clinic?
dispensers, though, do have an issue if you are selling to somebody who is not either a practitioner for in-office use or another pharmacy for a specific patient need. Dispensers under the DSCSA are not allowed to act as wholesalers. So you cannot transfer overstock to another pharmacy that's not owned by you. If you have overstock inventory and you sell it to another pharmacy to get rid of it, that's defined in the law as wholesaling and requires you to have a wholesale distributor license to do that and meet all the wholesale distributor obligations in the law, which is have the license, have the SOPs as a wholesaler, report it to the DSCSA repository at the FDA to say I'm a wholesaler, that kind of stuff. But if you're talking about a specific patient need to another pharmacy, you don't have that obligation to do traceability, and you can do that. You can't do borrow and loan. I know that's more of a hospital term. I don't think that's a term for you guys as much, but I did see this a lot in hospitals where it's Friday night. Another pharmacy calls you and says, patient just walked in, needs something, I don't have it here. And you say, well, I've got an extra bottle, I'll send somebody over with it. That's fine to do because of specific patient need to send that bottle over. What you can't do is then on Monday when they get their order, they can't send you a bottle back. There's no specific patient on the bottle coming back, so that's the part that the law has an issue with. You can send them a bottle and settle with them financially, but you can't send them a bottle and have them send you an in-kind bottle back. The law says that's a no-go. Okay? So I got the 2-minute hook here just a minute ago. I think I'm down to a 1-minute hook now. I will be over at the booth right here. You see DSCSA questions answered here. I'll be over there later today and all day tomorrow when we're open. Not immediately after this, though I do have to do something else immediately first. But thank you for coming today. I hope this was useful for you. On McKesson Connect, you will find video articles, written materials, all kinds of support for DSCSA. It's on the DSCSA resources page. Feel free to look in there and check it out. Thank you.